Back, we are going straight now to Delta State, to Asaba, to speak with His Excellency the Governor, um, Okowa, Ifeanyi Okowa. Good afternoon, sir. I don't have his signal.
You think you should take it down. Remove it.
All right.
Is it reflecting?
The first question that I want to ask is, as Chief Executive Officer of your state, can you give us a status assessment of the impact that COVID-19 pandemic in your state, and what structures have you put in place to stop the spread of the virus as we enter into this phase of gradual reopening of the economy?
Okay, first, like the program, it's good to talk to Nigerians concerning Delta State. Actually, as of today in Delta State, we've recorded 17 cases. We've had 2 discharges. Unfortunately, we've had 2 deaths, and the rest are currently being managed in various facilities. In Delta State, right from the beginning, we knew that we're likely going to have, of course, the COVID-19 with us. So we set out to have a task force. Our task force to manage all issues concerning the COVID-19 was actually inaugurated on the 16th of March. And thereafter, we set out to put our medical facilities in place. Currently, today, we have 4 isolation and management centers, 2 in Asaba, the Federal Medical Center, and the Asaba Specialist Hospital, 1 in Warri, the Warri Central Hospital, and Delta State University Teaching Hospital at Ogara. These centers are all properly equipped, and the right personnel have been trained. We've trained well over 400 staff at the moment. Both the health team made up of doctors, nurses, laboratory scientists, pharmacists, and also some auxiliary staff with them, including the drivers of ambulances, drivers of various vehicles that will be required with the epidemiology team. Of course, our emergency operations center has been activated even before the 16th of March. And having done all this, we have continued to put structures in place to ensure that we have public education of our people on the need for them to be able to incident suspected cases, and also on the need for them to ensure that they regularly wash their hands, maintain social distancing, and also on the use of hand sanitizers, along with all other things that we talked about having the proper etiquette. These isolation centers we've tried to put in the best of shape, and in the management of the cases that we have at the moment, I think we're doing very well. We also have to provide logistics in terms of providing enough vehicles for the contact tracing team, because it's very important. For every case that you have to ensure that the contact tracing is adequate and full. And thus far, we have traced 182 contacts, and we have traced all contacts of all our patients. 182 at the moment. Apart from the patients that were recorded just 2 days ago, we are still in the process of contact tracing of those patients. So as at the moment, we are fully prepared, and our medical team, they are in they have a high commitment, and they are passionate about doing the work. It's a very difficult work. We have ensured that we have also provided enough personal protective equipment for them, and we ensure that the team is trained on all aspects, because we have those who are in charge of the IPC, that is the infectious prevention control, and also those who are in charge of case management. And we have also had to train those who are in charge of the laundries, those who are in charge of the incinerators. There's a whole lot of training that has taken place. And I think everything is currently working for us. We've had a whole number of ambulances put up for the team because up until 3 days ago, all our samples were taken to ERA, Specialist Hospital for testing. But today we're lucky. We have a mini testing laboratory, and since the past 2 days, tests have been carried out directly in Asaba here. So a lot has been put in place, and we function very well.
All right. One of the reasons why we chose to speak to you, you're a medical doctor by profession. So I want to ask you this question. Which part has been the most challenging to deal with? And why has it been the most challenging in this battle against COVID-19 in your state?
Actually, the challenge that we've had is two-pronged. One is being able to deal with the issues of the economy of the people, particularly the informal sector, because in the process of trying to stop the chain of transmission, we have had to undertake a lockdown. And in dealing with that, it's actually very, very challenging for the fact that most of our people are in the informal sector and they have to live on a daily basis. They make their monies on a daily basis. And once you start that process, it means that you're going to keep their families hungry. That was obviously a very major challenge, which we're doing our best by way of being able to provide palliative support critically for the more indigent of the families. The second challenge that we did have is this issue of stigmatization, because our people are beginning to believe that having COVID is something that must be stigmatized, and we have been trying to carry on with education of the people to realize that this is a disease that can actually affect anybody, the high and the low. There's nobody that's exempted from it, and if you have not had it today, it's only because you're just lucky, or you have not been within a place where you can easily get infected. But we also do know that with the education we're carrying on, people are beginning to understand, and people are also beginning now to come out on their own to get themselves tested. Because the more you stigmatize the people, the more the patients will hide themselves in and continue to infect the people. So these have been the two ends of the challenge. The economy of the very low within the society, and which actually has been a huge problem. We've tried to provide those palliatives, but we know that we continue to have problems. However, in Delta State, we've already started doing an easing of the lockdown. And I think that even when we continue to provide palliatives, it's going to be much easier for us to manage at the moment.
All right, sir. I'm going to ask you one last question that has to do with the economy. How has COVID-19 affected your plans that you had for the state at the beginning of the year? And will you still be able to fulfill all obligations? If not, what are the changes that you are making?
Obviously, there is a huge challenge on our hands with the COVID. The Nigerian economy has been such that we are largely dependent on oil funds, and Delta State is one of the states that depends a lot on the oil funds, largely because also our workforce are better paid than workers from many other states of the Federation. And on that note, with a very shortfall in oil revenues, obviously it's going to impact on us. We are very mindful of this. We are beginning to review our budget, and there's going to be a scale down of our budget, but in such a manner that it will have while we continue to engage on some of the very critical infrastructure work that we are already involved in, like construction of roads renovation and construction of schools, keeping on with the health system staying strong. We also have to begin to readjust the budget in such a manner that we're able to impact on the populace, because the effect of the COVID-19 is going to make the poor poorer. And even those who are in the middle class, some of them are going to fall into the poverty bracket. So we are going to have ourselves readjust the budget to improve the funding, even with more limited funding, to improve the funding for social investment, to improve the funding for agriculture, to ensure that we're able to assist our farmers to be able to grow more of their products through all forms of support in terms of better planting materials, being able to support them with tractorization, being able to support them with fertilizers and the rest. And we are also doing everything humanly possible to begin to engage more of our youth. We have various forms of youth training programs, the Youth in Agriculture program, the skills training program that is doing quite a lot, and also the girl child training program. All these we're going to enhance the amount of money available for them in the budget to be able to train more of our youths and then keep them out of the street. Because the more of our youths are on the street, the more likely we're going to run into crisis concerning managing the security and managing the protection of our oil facilities. We are also looking very closely to see how much we can support the small and micro enterprises that are in the state. And funding is going to be enhanced in this direction. But obviously for the infrastructure, while we must continue with the critical infrastructure that reached a reasonable level of completion, some of the initial programs that we had are definitely going to have to wait on until the year 2021. But the mix of all this we're putting in place before the end of next week, we're likely to go back to the House of Assembly to ask for a reordering of the budget in such a manner that it will be more productive for us as a state and for our people, because we are quite mindful of this. And the health of the people is also very important, while we continue to ensure that the facilities for the management of our COVID cases remain very functional. We are health program, which actually ensures that every vulnerable person in the state is enrolled in our health insurance program. We must ensure that we continue to offer these services to our vulnerable persons, particularly children under 5, our pregnant women, and our elderly and the widows. And we have to continue to do this to be sure that we do not allow the impact of the COVID come very strongly against the very little finances available at the family circles. So we must do everything possible to empower the family to succeed going forward in the next few months of the year.
Thank you very much, sir, and for taking out time. Thank you for the work that you are doing to protect the people of Delta State and Nigeria at large. God bless you, sir.
Yeah, thank you so much for having me on this program. God bless you.